Hi everyone, welcome back to Alterminds. Today we have a little treat, and we're going to go over some questions, or at least the first question that we got recently at a speakers event. We were invited by the University of Windsor to present a panel discussion about autism. I guess it was called something fancier than that, wasn't it?
Well, yeah, it was presenting to the disability. Hang on now, I'll see if I can find the top of it.
Yeah,
Disability Student Law Society of Windsor. So that was the group that we were specifically speaking to. And it was a lot of fun. It was a small group, but it big conversations with small
yeah,
groups sometimes really go a long way. And I think that this one really did. So I mean it was a joy to be there. I was happy to get the invite, happy to do the gig. I think we had a lot of fun.
yeah, we did.
Yeah. Okay, so we're gonna talk about some of those questions. Like, well, one of the question in particular, which is something I don't think we've talked about so far yet, like our diagnoses of being
Mm,
autistic and ADHD and how we got
yeah,
to there, how we got to where we are here and why we're talking about all these things. I don't think we've kind of bridged any of that yet.
no.
No. Okay, cool. So should I just, read the question and then we can unpack?
Yeah,
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 cool.
let's unpack it.
Awesome. Okay. So the first question of this information was it's a two-parter. So studies show that there is significant underdiagnosis, especially as it relates to ADHD and autism in women and gender diverse persons. I see, yeah, I see because it's written by somebody else, the person who hosted the event for us. I see that you both had lived experience, and I would like to talk about the process of getting diagnosed. For example, when or what event or series of events made you begin the process of getting diagnoses, and what did that process look like for you? So, long-winded question, but
Yeah.
basically, what happened?
Yeah.
Yeah, you want to go first?
Um, yeah, sure. Okay, we'll start off with da da da. Studies show that there's significant underdiagnosis, especially as it relates to ADHD and autism in women and gender diverse persons. So that is true because the research that was done uh, for like assessments and things like that for autism, ADHD were done on young white boys usually.
Yes,
So
other thing. It's the colonial aspect as well.
yeah, yeah. So, um, a lot of research doesn't show or represent uh, the reality. It doesn't because they have a small sample size or like a sample size that just is representative of white men or white boys. So you don't see what autism or ADHD looks like in girls, so it's not represented. So that is one of the reasons why there's such an underdiagnosis in ADHD and
You were late
autism.
diagnosed as well too, eh?
Yeah, yeah.
How old were you?
How old was I? I think it was just recently. I was 30, 31.
Okay. What was the trigger event?
That made me want to go get diagnosed.
Yeah.
Um, I kept getting in trouble at work, and I worked with autistic kids.
What kind of?
Uh,
'Cause I think that that can look like a lot of different things for.
oh, yeah. I kept getting like, well, what felt like in trouble, I guess. I kept getting, uh, yeah, like talked to in a
Okay. Job
patron
coaching and things like that
in
kind of
a
stuff.
no, like talked to in a patronizing way
Um,
and made to feel like I was doing something wrong all the time, like as like I couldn't really win. And then there was a intense meeting that was had where it felt like I was being barked at, and just because I asked for some research, uh, yeah. So I called my doctor and I was like, I think I'm going to get fired. I feel like I may have autism, but didn't know it growing up. Uh,
mhm.
Knew I was different though, of course, but didn't realize what that was. Anyway, he was really empathetic and kind, and he felt my urgency, so he recommended I go private. So I was able to do that, which is something that not everybody's able to do. So if you go public, you'll be on a waiting list for many years. Yeah, but private, it's my cost was $1,700, but it can be much more expensive than that.
Yeah, I've
They
heard
get,
costs like up to like 5 grand.
yeah,
And honestly,
yeah.
who has that these
No,
days?
nobody.
People taking out mortgages and loans and stuff just to get this piece of paper
Yeah,
because in order to access services, the piece of paper is really critical.
yeah.
So, yeah.
So that was the event that triggered it. And what did the process look like? Yeah, so I was referred to a private psychologist.
Uh-huh.
And then she did a few sessions with me. I brought an autism binder though, so I did up a full binder like to
What
present.
did that look like?
Um, it was a bunch of the online assessments, so you can find it. So here's something: if you're looking to get diagnosed, you can find a bunch of the online assessments on Embrace Autism.
I had none of that stuff. I didn't know
Yeah.
anything. Social media.
So I filled out all those questionnaires and surveys and stuff, which is what, which is they are assessments though. They are like autism quotient assessment and the RADS. So they're legitimate assessments. Anyway, I did them and I put them in a binder. And then I had a bunch of like stuff written down on them because the questions are so
Weird.
so weird. Anyway, and
Us.
and I actually went through the DSM-5 criteria for autism and gave examples of why I fit certain criteria. I gave examples from my childhood and now, or what I can remember of my childhood and now. So I put that in the binder as well. And that was kind of like my here's my history and here's my where I'm currently am. And I definitely recommend people to do that because you can get maybe some costs taken down because your psychologist or psychiatrist will only have to read that and maybe they won't charge you for reading it.
No. How
Yeah.
did you feel during that process? Because, like, for me, I felt a big sense of relief, not doing the test because the doing the testing is really harrowing, but like doing the research and stuff like that. Like, was that relieving to you, or did that create anxiety, or like, how did
Um,
that?
I think it was relieving.
Yeah,
Yeah.
yeah. I found a lot of relief later when I gave myself permission to.
Yeah.
Leading up to it, I think was really stressful because of at that point in time, what I knew was very negative.
Hmm.
Like I had no understanding of ABA, so applied behavior analysis or anything
Hmm.
like that. And everything that I knew was if you're autistic, goodbye life. You have no quality of life or anything like that. Like I went a really long way into the research and stuff like that once I gave myself permission to go, okay, don't
Hmm.
you don't have to take it as a solid grain of fact that the people
Hmm.
who've been in the medical sphere talking about it and talking about it in a negative way. You don't have to
Yeah.
take it as that's the end all be all because it is not anywhere close to the
No.
actual experience.
No.
Okay, all right. So
Let's switch and do you now.
yeah, no, that's fine. I was just gonna say, like, were you happy after?
Happy's a hard.
Yeah,
Not happy. I was relieved and I felt validated because, my whole life I'd questioned why I felt so different to everyone else
yeah.
and why things felt so hard. Everything like from social, like back and forth to just getting stuff done that I was supposed to get done. All that was really hard for me growing up and still is.
Yeah, fair play.
So,
Fair.
yeah.
Okay, well, to go to me,
Yeah.
my process was a bit weird and different than most people I know. Most people I know, they look at their kids
Hmm.
when their kids are going through the process in school and things like that. And then people are like, well, how come you didn't pick up that your kid was doing this different thing? It's like, well, because it wasn't any different from what I was doing. So
Yeah.
why was it different? I'm not going to call it into question. It doesn't make any sense. Um, so I mean, I didn't have children that, were I have stepchildren, but we have no say in anything that goes on medically in any of that capacity. So I mean, I have strong feelings about how all that should go, but again, I mean, it's when you don't have that, because again, we tend to ignore the adults who are neurodivergent and the whole diagnosis process and stuff like that. We look at it as a kid disease, so to speak, a kid disorder, so we start there. And if you don't get it now as a kid, they're just like, well, use your coping and survival skills. Good luck
Yeah.
to you. So, I mean, for me, I I had developed all these coping mechanisms to survive up to, that point in time. And I was 40 when I was diagnosed finally. And it started out actually with me being in the kitchen at 5 o'clock in the morning, trying to help my husband get ready to go to work for the early shift. And I couldn't understand a freaking thing he was saying. And I thought I was losing my hearing altogether. I was just like, okay, I'm getting older, things happen, they go bust, whatever. I'm ready to string this guy up by his toes because I'm like, dude, please enunciate for the love of God. Stop slurring your words. So anyway, so I went to the audiologist, and the audiologist is like, your ears, the anatomy in your ears is fine. He said it's the wires in your brain between your ears and your brain that got crossed.
Yeah.
So the way I explain that now is, so it's called auditory processing disorder, and it does monkey with your life for sure. But it was good to know that there was reasons why communication was such a hard thing for me, because up to that point, I just thought I was an idiot. I really, really
Yeah.
thought I was an idiot. Because I'd struggled with on so many different levels. And of course, everything comes back to communication. It's what you understood and when and how and all that. And I put it down to me being a complete dumbass. And I know now that I'm not. But I also come from trauma survivor as well too. So it's really easy to believe you're an idiot when you've been told that by so many for so long. So you develop that mentality as well too, right? Like your confidence is shot. So it was good to know that there were things going on in the brain pathways and stuff like that I just didn't have understanding of yet. And so that's allowed me to ask much better questions in better ways and have a better understanding of what's going on. So that's where I started, was with the APD. And then after that, so I'm in the chronic pain program at the Miller Center here, as part of the rehab thing, learning how to deal with my disabilities and chronic pain and all of that. The psychologist part of the team, she had access to Memorial's psychology department. So she has, each semester, she can send two of her clients or two of her patients along to that program. And what they're doing is they're assessing clients, patients for autism, ADHD, other neurodevelopmental disorders, and things like that. So I got my autism diagnosis and my ADHD diagnosis through that pathway. It didn't cost me a cent, but I was a guinea pig for a program, and everything got signed off and stuff. So I mean, it's all authentic. It's just a very, everybody's like, well, what doctor? I didn't have a doctor. I have a GP now who is also autistic. I believe I revealed before. Of course, I'm not going to give his name because he'd be swamped. And not doing that. He's looking at retiring, poor thing. I don't blame him at all. But it became a much different conversation that I was able to actually have with him because he's neurodivergent than I'd ever been able to have with any practitioner that I've ever had. But it also changed the way that I engaged even with the pain program, because now I understood that I understand things differently. My experience is much different than a lot of patients who go through that program. When they talk to you about like, oh, the pain scale, I have no bloody understanding of what 1 or 5 or 10 means on a pain scale. Give me the Lego version where all the faces are all different and stuff like that. I can point to it and go, imminent death. Yeah, it feels like imminent death, which is a 10 on the Lego pain scale. Things like that make a lot more sense to me. So, I mean, it was relieving for me. But at the end of the day as well, too, that if I hadn't, um, it wouldn't have mattered what the diagnosis or anything like that was. After I'd had the opportunity to do the research and things like that, once I came to understand that there was other things going on, then yeah, it wouldn't have mattered what any doctor said to me. I had to come to that kind of acceptance on my own. Paperwork and stuff like that. Otherwise, be damned, it wouldn't have mattered. I needed that kind of relief,
Yeah.
and I got it through that process, and I was able to find supports, online supports, which was strange as well too for me. But there was a lot of things that came with that I would never have expected. But I don't know. I guess I was a version of happy. It was like, okay, cool. Thank God. Thank God I'm not just,
Mm,
thank God I'm not an idiot.
yeah. Yeah.
It was really validating in that way, like I was able to regain something that I never thought I would have had.
Mhm.
So, yeah, happy for me.
Good. Um,
I
so
can
I,
read the
th
second question if
yeah, I
you.
was just gonna say, I think we covered the first question pretty well. Let me just go through, I'm just gonna read it. Hold on. I'm
Yeah.
trying to push my chair forward. Studies show there's significant underdiagnosis. So the process for getting diagnosed, though, first, like say if someone is listening and they're thinking about getting a diagnosis, the process is you're going to need a referral to a psychologist who can assess for autism.
As an
And
adult in the
uh,
school system, they still do it
yeah,
purely. No.
yeah, as an adult, as someone over 18, yeah.
Mhm. And
And
that's
you,
scary because you have to get your doctor to actually believe it first.
yeah, that can be hard. So that's where the autism binder really can help. Getting those assessments online from Embrace Autism. Embrace Autism also has the research link to everything, so a doctor's way more likely to probably uh, sway your way
Hmm.
if they have links and stuff like that that they're probably going to read it, but just to show that you've done the research and you
Yeah.
looked into this. And um, the DSM-5 criteria, of course, is the diagnostic criteria for autism. So going through that and having examples of how you fit that criteria. And you might need to look into videos and articles written by actually autistic people, like on Neuroclastic or Autism Newfoundland and Labrador, or TikTok. Looking up actually autistic, looking up ADHD, that will give you some results that you can learn from people in your community
Be
to figure out.
clear, self-identifying is absolutely valid within our community,
Mhm.
but it doesn't matter much to the medical community and to the support systems at large. They
Mhm.
still want that paperwork. So yeah, it's helpful for people who can access it and need supports,
Yeah.
but just for your own self, in coming around and asking questions of yourself and looking back on your life and things like that, because a lot of people feel like their entire life was a lie.
Yeah. Yeah. Yeah.
Oh,
Yeah.
and there's no doctor that's going to make that good.
No.
Piece of
No.
paper is going to make good on that.
No.
So
And
self-identifying is critical.
you go public and you're going to be waiting a long time. You go private, you're going to be paying a lot of money. So both of them.
And you have to be prepared for your family and support systems, your informal support systems to go, well, you're not that way.
Yeah.
You know,
Yeah, you have a lot of people not believing you when you're, especially when you're late diagnosed.
yeah,
Um, that sucks.
it does. It really does. Or they'll be like, I had this one comment come back from a family member as well, too. Oh, yeah, next thing you'll be saying all of us are as well.
And the truth is, you
You're
do
like,
be
so what?
saying that. Yeah, because it's hereditary. So you'll notice things in your family that are very much traits of autism and ADHD or whatever it is that you've been, if it's hereditary, that you've
Yeah.
been diagnosed with.
Yeah. Well, I mean, you'll look back and go, okay, so that crazy uncle that everybody just thought was like eccentric Uncle Al, you
Yeah.
the reason you didn't find him that eccentric was because he was just like you.
Yes.
you know, and
Yes,
nothing wrong with it.
you'll have some Uncle Al's.
What's that?
You'll have some Uncle Al's.
Oh, do you? Okay, well,
No, you'll have them.
oh yes, yeah, yeah, yeah. To have them is completely normal. I mean, I have not a wide swath of my family are highly neurodivergent,
Yeah.
and that's the thing, right? Like we never looked at things as being that different. It was just like that cousin who just really liked peanut butter and crackers
Yep.
and for months, and that's all you'd eat. And it was, for some family members, they kind of looked at it and go like, "Oh my God, how come he won't eat anything else? He's going to die of some nutritional deficiency or something." And it's like, well, so now we would ask a better question and say, well, maybe there's a reason why he can only endure peanut butter and crackers. What is it about other foods? Now you'd ask better questions, or at least you'd like to think you would. But anyway,
So part two.
I don't know. I think the whole being able to have the discussion in a responsible way without a blame factor is really important.
Yeah.
Yeah.
So part two. After discovering that you had disabilities, what were the emotions that came with the understanding, and what process did you go through to discover supports you needed and find those supports?
Oh shit, I jumped ahead for a lot.
Or
Sorry.
or holes in the system with respect to support, and how did you advocate for the support? So let's break that down
Oh
into
yeah.
just let's break that down to the first part, which is after discovering you had disabilities, what were the emotions that came with the understanding? So I think we already talked a lot about it feeling validating and relief.
Yeah.
Um,
There are some people who don't look at this as being a disability, though. Like some people are able
mm,
to develop coping mechanisms for themselves that they may not even understand as coping mechanisms, but regardless of whether or not the fact that they are or not, but they're able to cope. And kudos to them because they've got supports
kudos.
behind them that allows them to have that. That's awesome.
Yeah.
That's not the standard.
No. And medically, right? To get a
Yeah.
you're getting a diagnosis from a criteria. Medically, you're going to be seen as having a disability because to even be able to meet the criteria, it has to be disabling.
Yes.
So it has to be this, yeah. So anyway,
Yeah. Well, it's a
my
whole,
hands
like,
going.
there's a whole system there, right? Like, some people have supports and they're able to muck through, you
Yeah.
know? Or, even if they feel that it might be a disability, they don't feel that they have the support systems in place where they can voice that. So
Mm,
they don't. So they just, whether they have coping skills or not, that's where you end up in the system. A lot of them being homeless or experiencing drug issues and things like that because they weren't able to access the supports that they needed and it went really badly wrong for them. If we were able to do a better job of understanding that, maybe we're not as supportive as we'd like to think that we are.
we are not as supportive as we like to think we are. It's
Yeah.
true.
I think if we can do a better job of asking better questions and stop assuming that because we feel we're open about stuff doesn't mean we actually are,
Yeah.
right? And not taking it critically. Like, I think that would go a long way to actually rectifying a lot of this gaps in the support systems and stuff.
Absolutely.
As, can you identify any particular ones for yourself?
Gaps in support
Yeah.
systems.
Yeah.
Oh, I struggle with daily tasks. So like keeping up with like cleaning and even self care, even self
Yeah.
hygiene and like care. So there's definitely gaps in support there for me. Like I can't get a respite worker unless I pay for it out of pocket, of course. I could hire someone myself.
Which makes no sense because I mean, if you're putting 100% of your cognitive stuff
Mm,
into job, say,
mm,
plus parents, I've often seen on a lot of mommy groups, it's like when they're talking about, the things that they struggle with, it's like
mm.
you can have the kids looked after, you can have the house looked after, or you can have food on the table, but you ain't getting all three.
No, you're never getting all three. You're always, something's always suffering.
Yes.
So so things pile up a lot for me because I'll let the cleaning go because I'll be having a rough week or a rough day even, right? And I'll let go whatever.
And then
It,
guilt sets in, right?
yeah, a lot of guilt.
Making it much worse.
Why?
Making it much worse.
Making it much worse. Yeah,
Yeah,
absolutely.
I get.
Um, what about you?
Okay, so I have multiple other disabilities. Like I'm
Yeah,
legally blind, have
yeah,
a hearing difference, APD, we just talked about that earlier. So it's already really difficult for me to navigate the world. Like if you think about reading, like how much reading on par do you do in the run of a
yeah,
day?
yeah,
Shampoo bottles, whatever, it doesn't
yeah.
matter. I have to use 100% of my resources just to do those things, right? So, and my memory recall is garbage. You know, like if I tried waitressing once upon a
Hmm.
time, at an eon ago, and I was the worst waitress ever. I'd be the one who would be like, okay, so they would tell me their order, and I would be like, okay, can you repeat the thing after I said hi? I'm Angie, your server. You know, because my recall is horrible. Even
Hmm.
I can't get to step 3 in a recipe. You know, like I
Yeah.
have to go through each and every single thing. So cognitive resources are really expensive for me and
Hmm.
made much more complicated by the vision loss and by the hearing loss, with the extra thing of having to get across the room because I also have mobility disabilities.
Right.
And right now, my hands are doing okay today, but they're having a lot of tremors.
Hmm.
So I have to negotiate how to do more tasks than the average Joe, so to speak, Joe or
Yeah.
Jane. Um, and it makes it really, really complicated. So what that has looked like in the formal support side for me is because our formal supports for home care don't recognize, they only recognize a person as a physical deficit
Hmm.
when it comes to actually helping the person out. They don't recognize it from a holistic perspective. Our policies now have changed to say we're looking at it from a patient oriented and we're implementing patient oriented policies. But that's holistic wording. The action is much, much, much less.
Hmm.
You know, I was bedridden for 6 weeks last year and like completely bedridden for 6 weeks. It took me 4 months to be able to actually sit up properly in a chair for any amount of time. And the support workers that they sent couldn't do anything.
Hmm.
They had to be guided for everything because there's currently no policies in place that say we have to train our workers how to actually help people with everything in the home.
Yeah.
And again, it's just seen from a physical idea. So even going to rehab, you know, and organizing all the things. So organizing the bus, organizing the worker, organizing myself, getting
Hmm.
dressed.
Hmm.
You know, I have to get my worker actually help me pair up clothes so that I look somewhat presentable.
Hmm.
You know, like I hope I am today. You know,
You are.
thank you. I appreciate that. These are really, really, really basic resource exhaustive things already for a person who's chronically disabled,
Hmm.
you know, or disabled by chronic illnesses,
Yeah.
let alone the cognitive resource issue.
Hmm.
So, I
Hmm.
mean, the fact that I even get out of bed some days I don't because it's
Yeah.
too much, you
Yeah.
know, and then depression sets in.
Yeah. Yeah. Depression. That's a hell of a.
Yeah.
Oof.
Yeah, exactly. And I mean, I think we both know how dark and fast that can go.
Yeah.
And I think we've both spent a lot of time there. And that's the thing, right? I think that's probably why, a big part of why we're doing what we're doing,
Hmm.
you
Yeah.
know, having those conversations. You can join a Facebook group and stuff like that. And you'll learn a lot in some Facebook groups, not all. Some are not as great as others. Um, but still, that's a really small little sphere of the community,
Hmm.
you know, and then that becomes your interaction space. And while that's great for connection and stuff, it doesn't go far enough, at least I
Yeah.
think, you
Yeah.
know? It doesn't reach the policymakers who now
Yes.
they'll be able to, you know, click the button on the Spotify or on the YouTube or whatever, and they can hear us talking about these gaps in the
Yeah.
system, lived experience point of view.
Yeah.
At least that's the hope. I'm hoping they do.
That's the hope, is that someone will listen. My goodness.
Yes, people have been
Um,
saying for a really long time about all the stuff that's not. But like, it's even the when we talk about saying somebody has autism versus being autistic, that goes back to the policy office, right?
yes.
Education still specifically says your child has autism,
Yep.
your child is ASD, things like that, because that's what the policy office specifically says. So if we want change, we have to go back to the policy office. It's no good to be just screaming it on Facebook.
No, because you're just screaming into a void. You're just screaming into the void, a black hole.
Yep.
That's
So I
all.
mean, there's lots of holes in the system to do with supports and things like that, but I and you can be an advocate, and be some of the best advocate going. But you're also going to have that time as well too, where you need to have somebody advocate for you. And I think that that's finding the right advocate is actually a really big deal, and it's
Yeah.
something you spend enough time talking about. Nobody
Yeah.
does.
So true. What process did we go through to discover the supports we needed and find those supports? Well, there's not that many supports that you can get.
Nope.
Ange has, you have respite care because of your physical disabilities.
And
Yeah.
only because of that, they refused to
Yeah.
recognize that I struggle with some of the physical disabilities because I can't, because I'm an autistic person and I struggle with executive function issues.
Yes.
Putting all the steps and stuff like that together is very complicated for me. And as an ADHD person, you have to remember, like they talk about habit building and things like that. As an ADHD person, I don't develop habits.
No.
You have to remember every single task. You have to remember to brush your teeth. You have to remember to comb your hair or whatever. You're full on goblin mode a lot of the times just because you did not remember you were supposed to
So
do that.
true. So true. But there is no supports out there, is what I'm
Exactly.
getting at. There's nothing. You can get psychiatry supports if you need medication,
Hmm.
or you can get help from your GP for other things that might be going on. But basically, you get diagnosed with autism, you get diagnosed as autistic, and that's
That's it.
it. That's it.
Yeah.
That's just, and then if you're getting any supports at work, it's because of your own self advocacy. So you have to know your rights, and you have to know what policies, you have at work, if you're at work, or if you're at school, what policies exist.
Yep.
And you have to advocate constantly for yourself to get what you need.
And if you're
And that
lucky
can
enough
be,
to work and you have
yeah,
access to an employee program, like a health program or something like that, where they give you 5 sessions with a psychologist or whatever on them, you're really lucky to be able to have that kind of support. And that doesn't mean that it's enough. It's definitely not,
no,
but their expectation is that it is.
yeah,
Their expectation is that it's kind of like when we say that a person gets 3 days for grieving.
yeah,
Grieving at its own pace, and it'll last as long as it lasts. It's not a 3-day thing.
yeah,
It's the same thing with getting an autism diagnosis. We grant people time off for cancer, you know,
yeah,
that's huge. I would argue not that being diagnosed as autistic and ADHD is bigger than cancer, but it's definitely on par with.
it's huge. Yeah,
Yeah. I mean, it has, a really wide, it's everything, right? Like we talk about, yeah, there's a diagram, I don't know, a number of years ago now, and it's a person and they're holding a bag labeled autism, you know?
yeah,
And the implication is that a person is with autism. They carry
yeah,
it in a bag and they can put it down at any given point in time.
yeah,
And that's
yeah,
how the medical system treats us.
yes,
We can choose to not be autistic at whatever given
yeah,
appointment be because it's convenient for them.
yep,
No, don't work that way. So yeah, it's a lot. And when it came up the other day when we were in that meeting as well too, like what kind of supports would you give to adult students in the classroom so that they could negotiate whatever exam they had to write or things like
Mm-hmm.
that. And I think that that was a really important question, but I think I think that the systems that we provide in education in particular in that way, like they're expecting a one route method,
Yes. Yes.
and that's not possible. I mean, people come with as many different disability aids to do the thing, whatever thing it is, as there are people. So a
Mm-hmm.
one route system that's supposed to look after everything, I don't think it's going to cover it.
It's not gonna work.
No, it couldn't. It by design. I mean, you're already set up for failure.
Yep.
So what would you? So you're a young fella.
Yeah.
He's going to school.
Yeah.
What would you tell him going to school about how to pretend he's older? He's not.
Yeah. He's not.
Pretend he's.
He's.
What would you tell him about how to tell people what it is that he needs in order to do the thing?
I would tell him to be straightforward and concise, um, and tell not only the teacher but the principal.
Yeah.
Make sure that staff knows. Sit down, have meetings with them. Make sure they know what you need. But you need to figure out what you need first. So that can sometimes be trial and error.
Yeah.
So you might need to even talk to staff about needing trial and error, so that you might need to try stuff one week and try another thing the next week.
Be prepared for that. Yeah, I think that that's an important ask. I think it's something we're not really doing now.
And I think what's really important for him to work with his classmates to have a student council, because I think student council is an important for the students to get what they need and their rights. So the students should know their rights at school.
Yeah.
You have human rights, the child human rights that they should know, and then you have your school policies that you should know or at least look into,
Yeah.
and that's how they can fight to get better. So if, like, students are having a hard time with test taking, or not getting breaks that they need, or need supplies and they don't have them, they can fight then towards getting those things for themselves, but they have to do it together.
Yeah. I look forward to the day when we don't have to fight, when these things
Yeah,
are
yeah,
a
yeah,
conflict, that they're
yeah,
just, I show up for my exam, but in order to do my exam, I need my headphones.
yeah,
And I need a very specific set of headphones because it's the only thing that fits on my head and doesn't drive me nuts.
yeah,
Unfortunately, they're attached to, they're an outside system. I can't wear the little earbuds thing that stick in your ear because it hurts.
yeah.
So, the thing that's not attached to any form of electronic transmission is not going to necessarily work for me. But that's the current ask, is that you have to be able to use some sort of headset that isn't attached to anything electronic because, they could transmit the answers and a whole line of stuff.
It seems like so much work and effort to pass an exam. I don't know how anyone would have the energy to do all that.
I don't either. But I do think that if you show up and you have your disability device
Hmm.
and for whatever reason it isn't approved or can't work, like my walker is a bariatric walker and I can't walk through the aisles of all the desks and
Hmm.
stuff like that, and they don't want to move anything off to the side because it interferes with their protocols.
Hmm.
Right. So, I mean, and that stuff happens as a regular basis. They're like, okay, we don't know where to put you. We have to put you on an outside table somewhere, maybe. And then you can't see the screen, but we don't know what else to do with you. That
Hmm.
kind of stuff is really real. So I've been in lots of professional meetings where that happens. So it's
Hmm.
not just to the kids, it's adults too. Um, but I think if that happens, like for an exam, I don't think it's a far stretch to be able to for the person to say, can I please do my exam on a separate day so that we can have time for you to check out my disability advice and approve it?
Yeah, yeah, I think that's a sensible. I think that's, to me, all this stuff that we talk about is just maturity, like emotional maturity. And I think that we seem to have lost our empathetic sides a little bit, because emotionally connecting with another human being, if they need something for their test and they don't have that thing, emotionally you'd be like, oh, well, then you can't take the test, obviously, because you'll have too much anxiety to take the test if you don't have the thing
There's
that you
that,
need.
and there's also I'm too much of a burden.
Mm.
There's that part as well too. I mean, I've experienced that where it's like I don't want to ask for my accommodations because it's too much of a burden to ask.
Oh, yeah, but that you gotta move on from that because it's not too
Yeah,
much of a
easier
burden.
said than done
I
though.
know,
Yeah,
I
easier,
know,
especially
but
when you want to do the exam.
yeah, yeah. I can understand that one to be a burden, absolutely, but I don't think that we should ever. It's so hard to do this though in practice, but I don't think that we should ever think of ourselves as burdens to other people because I think that that's what we're meant to do is take care of each other.
Yeah, and I know that stuff now,
Yeah.
but only through that education process because it was made available to me, and I knew enough finally to go ask for it. I mean, again, as a young kid, 19, I didn't know I could ask for anything,
Yeah.
so I didn't. And because I didn't, I failed out of a lot. I failed at a university, I failed different courses in university, I failed job interviews. It's awful when you don't realize that you can ask for help. It's not just being able to actually do it and knowing where
Hmm.
to go to get it. It's knowing even that you can, giving yourself that permission to say, I'm not a burden. This
Hmm.
is something I'm actually entitled to,
Yeah.
and having that freedom of being able to do that. I think those are really are things we don't spend enough time talking to our kids about.
Yeah.
I'd like to see more conversations about those types of things happening.
Yeah, me too.
Yeah. How are we doing on time?
We are about to finish up. So, yeah, we're almost at 45 minutes, so
Yeah.
we
Did
can.
I tell you that I made a connection earlier before, and this guy is able to talk about mental health
Mhm.
and particular organizations, local organizations that are dealing with mental health in the
Oh, we
U.
should definitely get him as a guest.
Oh yeah, definitely. And he comes bearing presents, Legos. He loves Legos, and he's got a wall of Legos.
Nice.
Yeah, so I'm gonna reach out and connect with him as well too, because I think he'd be a lot of fun. I just wanted to I wasn't sure if I told you there's that, but also like, the light things,
The light things, yeah. Talk about some light things. The light
today
things is
you can recognize that.
today's a pretty good day. I get to sit around a little bit at home in my house coat. It's been
All the
good.
fun things.
Yeah.
Glimmer. Are you doing glimmer
Yes.
or is this just self-care?
Both.
Yeah, fair.
Both.
Yeah.
Well, that's everything. We will say goodbye until next time.
Yeah. Sorry so long, folks. We're working on it. Well, honestly, we had a presentation there at the beginning of the week, and that was kind of the thing that we were building up to. We had a lot of stuff on the go.
Hmm.
We're also struggling with some of the tech and stuff as well, too, like passwords and things not working.
Yeah.
Meeting yesterday where my sound was not working at all, and I was ready to throw all of my tech through the window, the nearest window possible.
Mhm.
So bear with us if it's a little bit long. It's not that we've forgotten anybody or anything like that. We're working with the process.
We are.
All
All
right.
right. Bye for now.
See you soon.